Good afternoon, Albanmos. My name is Mihiraa. Let's start the warm-up session. Do you think nurses should attend continuous nursing education?
Yes, I do. The continuous nursing education program helps nurses to update themselves with the current practices in their profession. Moreover, nowadays it is mandatory to have specific hours of continuing nursing education to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It is always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult, but also rewarding.
How do you deal with someone who isn't satisfied with your patient care?
When faced with a dissatisfied patient, I assess the issue, determine if it's something within my control to correct, address their concerns, answer their questions, and collaborate with colleagues for alternative solutions if necessary. My goal is to accommodate the patient without compromising their care.
Tell me what you feel your greatest skill as a nurse is.
My greatest skill as a nurse is my communication ability. I'm very proud of my ability to listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard, and actively listening can help make someone comfortable. In addition, I learned that addressing their concerns and communicating assuredly make them feel comfortable, which is important to receiving quality care.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want to help, and when I can't, that's hard.
Your preparation time is over. You can now start your role play.
Good morning, Mihiraa. My name is Albin Mose, and I'll be your nurse today. Could you please confirm the reason for today's visit?
Good morning, Albin. I'm here for the biopsy, but I'm really nervous about it.
Thank you for your confirmation. I completely understand, Mihiraa. It's natural to feel a bit anxious before any procedure. Could you share with me what's making you particularly nervous about the biopsy so that I can support you better?
Well, I'm worried about the pain and what might happen afterward. I've never had something like this done before, and I just don't know what to expect.
Thank you for sharing that with me. Let me walk you through the procedure, Mihiraa, so you'll know exactly what to expect. The biopsy itself is a short procedure. Usually, it takes around 10 to 15 minutes to complete. Before the procedure, we'll use local anesthesia, which means that only the area where the biopsy is taken will be numbed, so you shouldn't feel any pain during the procedure. Afterward, we'll remove a small part of your skin for analysis. That's it. The procedure is over. Mihiraa, do you have any other specific concerns?
Okay. Thank you for explaining the procedure to me. Knowing the process makes me feel much more comfortable. But what happens afterward? Will it hurt a lot?
I'm so glad that understanding the procedure has made you feel more comfortable, Mihiraa. Now, let's talk about what happens afterwards so you're fully prepared. After the biopsy, it's normal to experience some mild soreness or tenderness around the area where the sample was taken. It might feel a bit like a bruise, with some slight discomfort, but this usually lasts only a day or two. The soreness is generally mild and can easily be managed with over-the-counter pain relief, such as paracetamol or ibuprofen. Mihiraa, I would like to reassure you that his procedure is very common and safe. We perform biopsies regularly, and complications are rare. Your body will naturally begin to heal the biopsy site immediately, and any discomfort you feel should gradually ease. So, overall, while you might feel a bit sore, it's a temporary and manageable experience.
That is truly reassuring, and it doesn't sound too bad. But nurse, I'm still a bit scared about what the results might show.
I completely understand how you're feeling, Mihiraa. It's natural to be concerned about what the results might show. But let's talk about why the biopsy is such an important step in your care. The main reason we perform a biopsy is to get a clear understanding of what's happening in your body. Sometimes, when we see something unusual, a biopsy is the best way to determine whether it's something that needs treatment or if it's harmless. By analyzing the tissue sample, we can rule out certain conditions or confirm a diagnosis with accuracy. This information is crucial because it allows your healthcare team to tailor a treatment plan that's exactly right for you. Remember, the goal of the biopsy is to ensure that you get the most accurate diagnosis possible, which in turn means you get the most appropriate care. Early detection and accurate diagnosis are key to successful treatment, and this procedure plays a big role in that. While it's natural to feel a bit scared, please know that the biopsy is a proactive step in making sure you stay healthy and get the best possible care. And whatever the results may be, we'll be here to guide you through the next steps, ensuring you have all the support you need.
I guess that makes sense. How long will it take to get the results back?
Mihiraa, it's completely normal to want to know what to expect next. Let me walk you through the process after the biopsy. Once we take the biopsy sample, it will be sent to a specialized laboratory where it will be carefully analyzed. This process usually takes about 1 to 2 weeks. During this time, the lab will examine the sample to give us detailed information about what's happening at the cellular level. After we receive the results, we'll schedule a follow-up appointment for you with your healthcare team. During this appointment, your doctor will go over the results with you in detail. They'll explain what the findings mean, whether they're normal, or if anything requires further attention. If the results indicate something that needs treatment, your doctor will discuss all the options with you, including the best course of action to address the issue. Now for today, we'll meet with the doctor to discuss the procedure in more detail. The doctor will also answer any other questions you might have and get your consent to proceed with the biopsy. After that, we'll prepare you for the procedure and then perform the biopsy. Are you okay with waiting a bit longer to meet with the doctor?
Yes, I can manage that. Thank you for explaining everything so clearly.
You're very welcome, Mihiraa.